And you said about reproductive, sexual reproductive work and reproductive work. Do you think that people have got a fully understanding of what needs to be supported for women in the workplace?
No, in a word. I think there's been quite a lot of interest around the menopause recently from kind of a broader social narratives around the menopause revolution, Davina McCall, all of that kind of stuff. Government is showing an interest in that, particularly in the women's health strategy, and particularly calling on employers. And we had Helen Tomlinson as the first government menopause employment champion. So I think there is movement there. And on the back of that, a lot of other health issues have become, they are present on the agenda at a national level. So talking about menstrual health, fertility issues, fertility treatment, pregnancy loss, but they are still a minority of organisations that have provisions. So the CIPD does a health and wellbeing survey every year, and for the last 2 years they've included specific questions on wellbeing issues that affect certain demographics within your workplace, and all of those issues are on there, as well as things that affect men specifically and stuff around sleep and things like that. But whilst I think it's 46% of organisations now have a policy or provisions to some extent around menopause, it is only, I think, something like 17% for menstrual health, 20-something% for fertility treatment, a little bit more for pregnancy loss. But, it is still about, only about a quarter of organisations that would have something for these. And it tends to be larger organisations as well. So particularly a lot of people work in SMEs, I think it's less likely to have these more advanced kind of going over and above statutory, because there's no statutory requirement at the moment, no legal requirement to have anything for menstrual health, anything for fertility treatment, anything for pregnancy early pregnancy loss, sort of miscarriage. So there are more likely to be the large organisations or the government-funded public sector ones that will have provisions around that.